Helping you live healthy. March is Colorectal Awareness Month, and it's the third leading cause of death nationwide. Well, joining me this morning to discuss the importance behind annual exams and what we can understand about the disease is Dr. Alex Crean, surgeon at HCA Florida Memorial Hospital. Good morning, and thank you so much for joining us.
Morning, Brianna. Thanks for having me.
So tell me, why is it so important to have a colonoscopy?
So it's important because it's really the gold standard screening test for colorectal cancer. And as you guys have mentioned before, the age has now been moved from 50 to 45 over the past few years because we're finding colon cancers in younger patients, unfortunately.
Wow. So who does colon cancer really affect? I know often we always hear about, men, the importance of them to get colonoscopy. So tell me a little bit about that.
No, that's a great question. From a gender standpoint, it's fairly equal between men and women. And that's the thing. That's why we screen for it, because a lot of times when you have symptoms of colon cancer, which you can be bleeding or different bowel movements, abdominal pain, that can be later in the game. So that's why if we can pick things up early, we can prevent it from ever happening, or we can treat it at an earlier stage when it's more effective.
I know you said it's affecting younger people. Can you tell me more so that age group right now that it's targeting?
So what we're seeing, the old thinking was to start at 50 because that's when we kind of anticipated people would get diagnosed. But unfortunately, we are seeing colon cancers, not too commonly, but happening in patients that are ages even in their 30s and 40s. So that's why it was a big decision for a lot of the societies to make recommendations to move the age to 45. So we're picking things up earlier. And that's for anyone without any risk factors. If you have risk factors, you want to talk to your surgeon or GI doctor, gastroenterologist about even earlier than 45.
Wow. So what do those risk factors look like? Do you have to consider your family's history, if you have any relatives that suffered from colon cancer?
Yeah, that's absolutely right, Brianna. So if you want to talk to your family, see if anyone in the family had any history of colon cancer, rectal cancer, even polyps. And then there are some other people that have things like inflammatory bowel disease, so Crohn's disease or ulcerative colitis. And there's some other types of genetic conditions that can really make you want to think about getting a colonoscopy even before 45.
And besides colonoscopies, are there any other ways to prevent colon cancer that you recommend?
So we can just live a healthy lifestyle. So having a healthy diet, not smoking, being good with your exercise regimen. Those are things that anyone can do to modify their risk. But unfortunately, sometimes we can't do anything about it. That's why we have to screen and pick it up early or pick it up before it even happens.
And I know screening is so important. Tell me how treatment has improved over the years for treating colon cancer, because I know we've come such a long way.
Yeah, we've been blessed because we've gotten so much research involved with it. It's gotten so much attention. Treatment of colon and rectal cancer usually involves a combination of surgery, potentially chemotherapy or radiation as well. The technology for all three has become so much better for the patient. From a surgical standpoint, we're able to do very big surgeries through very small incisions using robotic laparoscopic technology, which really helps patients recover faster and just kind of get back to their daily lives in a much faster and easier recovery.
And really quickly, Dr. Crean, what piece of advice would you give to those who, you kind of feel that something's not right, but you're a little reluctant to go to the doctor? What would you say to those people?
It never hurts to ask. There's a lot of information out there. We have a lot of information on our Memorial Hospital page or on our website, masjax.com, or speak with your primary care physician, your colorectal surgeon, your gastroenterologist. You're never going to regret asking, should I get a colonoscopy?
Taking care of yourself and asking those important questions are so vital. Thank you so much, Dr. Alex Crean. It was a pleasure having you this morning.
Thanks. Have a great day.